in the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air,
03 wheel lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Oh, just need to check.
to stabbings.
We're going to put some oxygen on your pals.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight,
ETA 4 minutes.
a man is crushed beneath a quarter-ton engine.
Fire will be there to get the engine off his legs over.
On the top floor in the top corner here.
A cardiac arrest on a squash court.
Onto your back, John. Sorry, mate.
A DIY disaster.
Isolated abdominal injury with partly eviscerated bowel. Hold on to my hand.
And a passenger is trapped after a serious car crash.
Have you got some morphine to draw up? I think he's going to need it no matter what, isn't he?
The critical care team was formed with one aim: to save more lives. Operating 24/7 and crewed by highly qualified doctors and paramedics, their fleet of vehicles are prepped with life-saving equipment and ready to scramble at a moment's notice.
What day is it? It's Sunday. It's 7 o'clock in the morning.
32-year-old critical care paramedic Tom Waters is about to start a 12-hour shift.
We check all our kit every day, so then nothing gets missed out. I like to just make sure everything's in its special place. It all gets used on a daily basis, so make sure nothing's missing.
After working in the ambulance service for 6 years, Tom underwent 18-month specialised drugs and life-saving skills training to become a critical care paramedic.
In ambulance, traditionally, we'd only see a major trauma patient or someone who's suffered a significant car accident or whose heart has stopped beating maybe once or twice a year, where our job is to deal with cardiac arrests, major trauma patients on a daily, regular basis.
Ambulance service, is the patient breathing?
Yes,
And
but
they
the person's on the floor.
away.
Yes, but the person has cut the belly.
Have they
Oh, it's
fallen? They've put
Yeah, they're on
themselves
the
with a
ground.
chainsaw. Are they able to see to me?
No. Oh my God,
Okay.
everything's out.
His intestines.
Yeah.
Has he lost enough blood to fill 2 mugs?
Yes, a lot. Please, just come.
We're coming on blue lights and sirens, so we're going to be there as quickly as we can.
It looks like a 43-year-old male who has sustained an abdominal injury from a chainsaw, and his intestines are out on the floor.
An ambulance is already on scene, but the man's injuries are so severe that they've requested critical care backup. Tom has been dispatched.
It's easy to paint a picture, but you really don't know until you get there.
11 minutes after receiving the call, Tom arrives at the address. His body cam records every detail of the horrific scene.
Hi, you're right. Hello, sir. My name's Tom from the air ambulance. What's your name?
The injured man, 43-year-old forklift driver Rafa is being given oxygen by the ambulance crew to try and keep him conscious as his body reacts to the shock of the 5-inch wound to his lower abdomen.
Right, so with this, if you just want to cover that with that. Perfect.
I'm just taking a photo of it.
No, that's fine.
Just in case you
Right then. That doesn't look too bad.
It looks like it's adipose tissue more
Yeah.
than anything, doesn't it?
The blade has sliced down through skin and flesh, exposing his intestines.
Oh.
Tom needs to try and keep the wound clean, prevent his intestines coming out, and stop the bleeding.
Hopefully, if we can just hold it around it will stick to it a little bit. And then, if I can get you guys to put some tape around that, is that all right?
Just going to stick the dressing down, Raphael, OK, just to keep it clean.
OK, so this gentleman, age, I believe you already know. He's a GCS of 15 at the moment with isolated abdominal injury with partly eviscerated bowel.
With such a deep wound, Tom knows Rafa could have catastrophic internal bleeding. He needs to get him to hospital fast for emergency surgery.
I think my initial plan would be to get some IV access, wound management, and then convey him to the QE.
The danger is that moving him may put too much strain on him and send him into cardiac arrest.
How are you feeling?
All right.
Sam, can you get some IV access? Is that all right?
Traffic element 03 Alpha's road to start recall 4 PRB and heading east towards...
The most serious emergencies require a doctor-led trauma response. The Midlands Air Ambulance can fly a hospital doctor and critical care paramedic to 90% of the region within 8 minutes, delivering advanced life-saving care to the roadside and fast transfer back to hospital.
Ambulance services, the patient breathing.
Yes.
Are they conscious and awake?
Yes. Me and my husband are moving some mechanical equipment around the back of our house and it fell on him and he's broken his wrist and there's like a big engine sitting on his leg.
Okay, so he's trapped under it at the moment?
Yeah.
What's it an engine from, a car or?
Yeah, a Land Rover.
Okay, sweetheart, we'll be with you as quick as we can.
So 3 got ETA 4 minutes. Have you got any details on the case, please?
Dr. Matt Rowley and critical care paramedic Karen Baker are en route to a code red emergency.
Patient in the back garden who's been working on the Land Rover's engine. It's fallen onto him, trapping his by his legs. Fire will be there in order to get the engine off his legs, over.
A man is lying crushed beneath 1/4 ton of cast iron. The range of potential injuries are so severe, the critical care team have been scrambled.
Our point of view would be go do an assessment, look at his airway, breathing, circulation, and see if there's any immediate interventions we need to perform that may be life-threatening to him.
Helimed is above the house within minutes.
Okay, you think we've got, fire service, just coming down the right-hand side there. So it looks like this field here is going to be about the nearest. There's horses in that, unfortunately. We're just looking if there's anything in that.
Yeah, that's fine. Yeah,
okay, cool, we'll go with that.
A paramedic working on a regular ambulance will only see a couple of major trauma incidents a year.
All good on the left there, Cass.
Yeah, all good.
Thank you very much.
But these guys deal with the most critical emergencies every day of the week.
There's a catch there.
03 on the ground.
It's now been 15 minutes since the 999 call came through. Matt and Karen are concerned the longer the man is trapped under the machinery, the more damage is being done.
If they've managed to get it off quite quickly, then we'll be looking at some soft tissue damage and fractures. If it's stayed on his legs, how long it's crushed his legs for, because then you get problems with circulation.
Hello.
How are we doing? You all right?
Says you can feel it. Obviously, it hurts.
Yeah.
Arriving on scene, Matt and Karen are quickly briefed by the fire service and a local ambulance crew before they can take control of the rescue.
He has got a collis fracture on his left wrist as well.
Okay.
So we're just in the process of getting the engine off.
Okay. What's your name, fella?
Dave.
Dave. My name's Matt, one of the doctors off their ambulance. All right.
Scrapyard manager and Land Rover enthusiast Dave Evans was renovating one of his old vehicles when the heaviest part, the engine block, fell off the workbench.
Can we get you back on this gas and air?
Dave tried to stop the fall, but the huge weight was too much, breaking the bones in his wrist.
And it's just toppled over onto him from there, has it? Presumably.
The ambulance crew have splinted Dave's broken wrist and given him gas and air and intravenous morphine to help him deal with the pain.
How's he doing with the morphine?
Although Dave appears calm, Karen is worried about the potential injuries to his leg that they can't see.
Is it from the lower leg?
What I can only see just around the knee, I can't see below.
Has he got a distal sensation?
Karen is worried the engine could be restricting the blood supply down his leg. This could lead to Dave losing his foot.
All right, we're all.
It's essential they get the weight off before it's too late. The critical care team cover an area of 5,000 square miles in the West Midlands with a population of 5.6 million people.
Ambulance service is a patient breathing.
Every day, the ambulance service receives around 4,000 emergency calls. But when the call is critical and there's every chance the patient won't make it, that's when the trauma specialists are needed.
Going to the big job now. See you later.
The number one call out is to people whose heart has stopped pumping effectively and gone into cardiac arrest.
Coming through a big cardiac arrest in the street.
Yeah, that's all received. We're showing about 7 minutes away.
Every minute the patient's in cardiac arrest, their chance of survival decreased by about 11%. So the quicker someone starts CPR, the more likely it is that the patient will survive neurologically intact.
Obviously, we're hoping when we go to a cardiac arrest that we can get an output back. We've got the Lucas device which we can use, and we've also got drugs that we can give, medication, which obviously increases their chances of survival.
Ambulance service patient breathing.
No, it was someone who's playing on the court next to us. There's staff around him and they're doing CPR.
Right. I know that they've got access to a defib then. I presume one of the staff members got it.
Yeah,
they have. Okay, right, we are coming as quickly as we can, okay.
A 72-year-old collapsing with a sudden cardiac arrest is an immediate code red emergency.
Good.
2 local ambulance crews have already been dispatched to the scene. But as fewer than 1 in 10 people who suffer an out-of-hospital cardiac arrest survive, 28-year-old critical care paramedic Aidan is also en route.
The AED's being used, 1 shot's being delivered.
Excellent, thanks, bud.
A bystander has managed to restart the man's heart with a defibrillator, but it could re-arrest at any moment.
I'll go Lucas in hand.
The Lucas chest compression system allows Aidan to continue resuscitation mechanically even while on the move. It's a vital bit of life-saving kit for the critical care team.
Looks like it's in a squashed court on the top floor.
Arriving at the sports centre, it's now 20 minutes since the call came through.
Excuse me, upstairs?
Yeah, absolutely. So up on the top floor in the top corner, yeah.
Thank you.
When a person has suffered a cardiac arrest, time is critical. Every minute the brain is starved of oxygen, there is a greater risk of stroke and long-term brain damage.
Hello. How are you doing, everyone? All right? How are you doing? Hello, how are you doing?
4 paramedics are already treating 72-year-old John.
Went to hit the squash ball, collapsed, fell flat on his face. The gentleman over there gave him mouth-to-mouth, chest compression.
Yeah.
He started breathing again.
His condition was so serious, it took staff at the sports club 6 minutes and 3 attempts with a defibrillator to get his heart started again.
Has he got chest pain or anything at the moment?
He has got chest pain like global all over.
Okay.
It's very funny.
The paramedics have put John on an oxygen mask and hooked him up to an electrocardiogram to give an accurate reading of how well his heart is functioning after the cardiac arrest.
We'll just sit him onto his bum, stand up on his feet, stretch him behind him. Onto your back, John.
Taking charge of the scene, Aidan needs to get John off the floor, onto a stretcher and into hospital.
Alright, what's happening? Where's that pain?
If he has a second cardiac arrest, it's his best chance of survival.
When you guys got here, he was OTCS 15, a bit agitated, but he was conscious and stuff.
No, he was very combative, he couldn't talk.
Okay, let's just shave all this off a second where we can, and then get the pads on. It's obviously high chance of rearresting now.
Although John is conscious, his brain was deprived of oxygen for 6 minutes. It's left him confused.
John, where's that hurting, mate? In your chest? Okay. Does it feel like you've hurt something as you've fallen?
No.
You don't know? Okay.
He fell first.
John, are you listening? So, I know that's really painful. We've got to get you up off the floor in order to get you into the ambulance and off to hospital. So bear with us. Let us help you. Just wait a second.
These chest pains are a sign of restricted blood flow to the heart. It's a clear warning that he is in danger of suffering another cardiac arrest.
Match me right. First of all, John, just sit up for us. Not stand, just sit for a second. All right, just wait there. After 3 then, John. 1, 2, 3, push. Let's have a seat on there.
Sit down, John.
Right, relax your head down to the right. Down to the right. We'll swing your legs up. 1, 2, 3. There we go. Just square yourself up into the middle for us, John. Okay.
Having got John onto the stretcher, Aidan is able to manage his airway and restart chest compressions if necessary.
So he's not had any medication or anything yet? No. Lovely. I'm just going to give you a bit of a spray in your mouth. Might make you feel a little bit lightheaded, a little bit dizzy. If it does, just let us know. Okay? The tongue up for me. Lovely. And pop this in your mouth and just chew that around for me.
Aidan gives John a nitroglycerine spray to expand his blood vessels and an aspirin pill to thin the blood to increase the flow around his heart. Now he's ready to start the journey to hospital.
Was it yourself who did the CPR?
There's a few people.
Well, you guys have absolutely saved this man's life, so you should go home very happy. Well done. Thank you very much. Guys, nice and steady. Just slow it down just a bit.
Leaving his vehicle at the gym, Aidan will travel with John in the ambulance in case he has another cardiac arrest en route.
Right, it's going to be a bit bumpy, okay?
He won't leave his side until he's safely delivered to hospital.
Nice and steady there.
He's had operation, yeah?
Yes, he will need to.
In Walsall, critical care paramedic Tom is treating 43-year-old Rafa. He needs urgent hospital treatment following a DIY accident with an electric saw that's cut open his abdomen.
All right, we're going to cut this off.
It isn't safe to move Rafa until Tom knows the full extent of his injuries.
Right, just put him forward. I just want to check his back while we're here.
Yeah.
It's very sweaty, isn't it? OK, so no other injuries. Was this done on a chainsaw?
Yes.
Can you find out exactly what's happened?
The gentleman there speaks English.
How are you feeling?
He went on a ladder. He was doing something around this thing.
Yeah.
And yeah.
It turns out Rafa was fixing the guttering with an electric saw.
This one?
Yeah.
When the ladder slipped, the saw ripped through his abdomen.
Yeah, 6'2", just an update. So heart rate's around 50 at the moment.
Rafa's blood pressure is low, which could be a sign that the blade has damaged some large blood vessels internally or even perforated the bowel.
He's quite clammy and sweaty at the moment. I see no immediate signs of him hemorrhaging, however, don't know how deep it is.
They have to get him to hospital.
I'm going to get him in the back of the ambulance and convey QE. I'll put some details as we go. OK then, Rafa, we're going to put our chair here. We're going to get you to move you and take you into the back of the ambulance, OK? My only concern is he's a bit hypotensive, so he might go a bit funny if we stand up. So we're trying, obviously, avoid as little movement as possible. Hold on to my hand. OK. Do you feel like you can walk? No. OK, that's great. Are you sure? OK.
Despite Rafa's horrific injuries, Tom has no choice but to move him onto the ambulance.
Yeah.
Keeping the pressure on the wound to stop his intestines spilling out.
I'm just a bit worried he's a bit hypotensive, so we'll just take our time. Well done. OK, so up you come. So At the moment, this gentleman's got a circular saw accident to his stomach, part of his bowel, and a lot of his stomach is out at the moment, so we've dressed it. I'm going to give him some drugs to stop him bleeding and pain relief and take him to the major trauma hospital in Birmingham.
Just going to give you some pain relief, some paracetamol, okay, to help with your pain, Rafa.
How are you feeling? Yeah?
They head to the major trauma centre at the Queen Elizabeth Hospital, where Rafa will need immediate surgery to repair the wound and stop any internal bleeding.
Rafa, are you all right holding that?
On the journey, Tom needs to keep his patient under close observation. There's a real danger his low blood pressure could suddenly drop, putting him into cardiac arrest.
Rafa, how are you feeling? All right? Good. Well done. You're doing a great job. We're nearly there.
Arriving at hospital 23 minutes later, Tom can hand over his critically injured but now stable patient to the waiting specialists.
Thank you.
In an average 12 hours, Tom will attend around 8 life-threatening emergencies, testing his techniques, drugs and specialised equipment to the limit in some very challenging environments.
I've obviously seen the worst in people and the best in people, but I've never really had an issue of taking it home. I've got a very small baby and a fiance, and that pretty much fills my life in the evenings, so. There are days where you have jobs which you get flashbacks. You know, at worst, it's always children, isn't it? But fortunately, I seem to manage quite well with that. I feel like I'm relatively thick-skinned.
For Tom, there's no such thing as a quiet shift, and there's never long to wait after the end of one job until he's needed again. An ambulance has been dispatched to an address in Dudley for a code red emergency involving a seriously ill child, and they've requested critical care backup.
5 minutes away, and we don't know too much information, but we think it's a 10-year-old who's not very well.
Sick children can go downhill very fast. A sudden onset of disease can easily overwhelm their body's vital systems, so early diagnosis is paramount.
Assessments of children are generally really hard, and there's always things that can get missed.
He arrives on scene 14 minutes later.
I went in through the side.
The paramedics have already moved the child into the ambulance.
Hey, buddy, you're gonna be sick. Wherever you're at. All right.
It's every paramedic's worst nightmare. The boy is presenting advanced symptoms of one of the most deadly childhood diseases.
I think that kid's got meningitis.
Let's come off the oxygen just for a minute, guys. We'll just come off the oxygen.
In Wolverhampton, critical care paramedic Aidan is battling to keep 72-year-old John alive and breathing after he had a cardiac arrest while playing a game of squash.
Sorry, mate. Relax. If someone's got some morphine on this truck, if someone can draw some morphine up, if that's okay. And then we'll work on just getting a posterior ECG, see whether we can get him straight to PCI.
John was without oxygen for 6 minutes before gym staff restarted his heart, which left him confused. But 27 minutes later, he is starting to become more lucid.
John, so I think something's happened to your heart. Okay, so we're going to be taking you to hospital shortly. Okay, you've had a collapse whilst playing squash. Yeah. We'll take good care of you. All right. Okay. Have you ever had a heart attack or anything like that before?
I had a murmur once.
A murmur. Okay, you never had surgery on your heart?
No.
No, okay.
It's now 33 minutes since John collapsed.
Right, John, we're just taking a little scan of your heart.
Okay.
We need you to stay really still for a second. Okay, nice and still for us.
Aidan needs to run a second ECG to try and find the cause of John's cardiac arrest.
Just 2 seconds. Is that a good trace? It's all right?
Yeah.
Yeah. So, guys, we'll head off in just a second. If it's OK, just have someone can drive my vehicle. I can do with somebody else in the back, though, just in case he has another arrest. Yeah, just nice and steady, bud, that'd be great. And there's just going to be a little scratch on your hand, OK?
En route to hospital, John is given 2.5 milligrams of morphine, a fast-acting painkiller, to help make his journey more bearable.
So, John, we're going to New Cross Hospital at the moment. Obviously, we think there might be something a little bit wrong with your heart at the moment, OK, which has caused you to have this collapse, OK? So when we get to the hospital, there's going to be quite a few people there who are going to want to speak to you and ask you some questions, OK? We'll take good care of you, OK? You say you're winning the game of squash. Are you sure? Do you normally win against this chap? It looked like an elderly gentleman.
So he ain't playing with you again?
No, I've only been playing
40 years?
Yeah.
Crikey. You should be all right by now, then.
I'm struggling to remember what that is.
You've had a period where you've lost consciousness. Yeah. So that would be expected.
Right.
Yeah.
6 minutes later, they arrive at New Cross Hospital, where Aidan delivers his patient safely into the care of the waiting cardiac specialists. For John, it's been a lucky escape.
Obviously had a cardiac arrest, a really serious situation. We're probably in the best situation that we could be now, considering he's had this cardiac arrest. So he's now relatively stable, his heart's beating okay, he's breathing. So they're going to do a few more tests to see exactly what it is which has gone wrong with his heart and treat him appropriately from there. So really happy, really good outcome, and just emphasising the importance of bystander CPR and community access defibrillators, which undoubtedly saved this gentleman's life. So yeah, really good.
Yeah. 12 miles away in Stourbridge, Dr. Matt Rowley and critical care paramedic Karen Baker are on scene with 40-year-old Dave, whose leg has been trapped under a 1/4 ton of Land Rover engine for the past 35 minutes. Every second counts, because without proper circulation, there's a real risk that the leg won't recover and it will have to be amputated.
The leg can just go ischemic. You cut off the oxygen supply, and then that builds up toxins. And then, of course, when it's released, those toxins can then go into the main circulation.
The fire brigade are trying to free Dave using hydraulic lifting equipment, but without a clear view of his trapped leg, it's hard to get the machinery into the correct position without risking even more traumatic injuries.
Right, that's it. Really slow, deep breaths now.
He's had 15 milligrams of morphine and continues to take gas and air to deal with the intense pain.
Right, let me hold it. Good man, that's it. And again. Deep breaths.
With the lift now in position, the firefighters and medics work together.
Just tapping me, folks. My leg's loose now. Just me, folks.
Good. Deep breaths, Chris. We're supposed to do this, mate. Go on.
Right, sorry.
Deep breaths, I say, well done.
Oh. Hang on.
No, Chris, just hold it there.
You're going to help yourself, though, would you, right? Go on, forward. Okay. Go on, forward. We shoot.
Smash it.
Go on. Go on.
Well done.
There we go.
With Dave's leg finally free, Matt and Karen can assess how badly it's been damaged.
Good man, let's have a little look at it.
How's your pain now that you've come out?
Just because my foot's been crushed, but I don't feel like it's broke. My wrist is definitely broke.
Yeah. Are you tolerating the pain at the moment?
Yeah.
That's a lot better.
My leg feels fine.
Good.
That's very good.
Your toes a bit blue then.
Give your toes a wiggle. Good man, well done.
Miraculously, despite being trapped under a 1/4 ton of cast iron, Dave appears to have escaped with just some painful bruising.
Shall we get your chair, do you think? Yeah. We'll pop him in a chair and go over the back.
She gets to shout at you now you're all right.
You'll just have to do it in the house next time, won't you, where it's dry? Be all right. He's been very lucky. It's just sort of pinned his leg to the floor. He's got no serious injuries. People can come off much worse if he'd fallen on his femur, his pelvis, his abdomen, his chest. You know, his injuries could have been far more significant.
Dave is being taken to hospital by the ambulance crew, leaving Matt and Karen clear to respond to the next emergency. Over in Dudley, critical care paramedic Tom has just arrived on scene, where a young boy is critically ill.
Are you going to be sick? Can we have you around? All right.
He is displaying symptoms of meningitis septicemia, a rare bacterial infection that kills 10% of children who catch it.
Oh, bless him. And sorry, he's 10 years old, isn't he?
Yeah. 10.
Okay.
10-year-old Harry was sent home from school yesterday with what seemed like a vomiting bug. Now a rash has started to spread across his body.
See you in a bit, Harry. Your mum's coming forward with you, okay?
A dangerous sign the disease is advancing fast.
I am 1.2 grams, dissolved in 4 mils, 1.2 grams, 4 mils.
Tom knows if his diagnosis is correct, he doesn't have long to get the infection under control before it enters Harry's bloodstream, where he won't be able to halt it.
Well done, Harry. Very brave.
We're going to give him an injection to his arm as well. He's going to have 2 injections, if that's all right.
Tom will need to administer the potentially life-saving antibiotic there and then before they get to hospital.
Well done, buddy.
With a son's life hanging in the balance, Harry's mother Laura can only stand by and watch.
Okay, bud. That's the first one. Go ahead.
Hi, Tom Choice Bobby. Just wondered if you had any clinical update whether you required it.
Yes, it's got quite a significant rash along his body. Reduced ECS. Given Ben pen now.
What's the actual copy was speaking of it?
So that's
600.
That's 600.
Yeah, so he's having 1.2.
Right, then we'll get ready to go. Are you ready, mate?
Tom knows it's critical they get Harry to hospital as quickly as possible, where he has the best chance of recovery.
Do you want me? How about if I do the pre-alert for you, and then you could get going then, couldn't you?
Fine, yeah.
There you go. And I'll say 7 minutes to Russell's Hall.
Immediately, the second dose of antibiotics is in, the crew prepares to leave, while Tom calls ahead to pre-alert the hospital staff.
Hello there, it's Tom, one of the critical care paramedics. Can I pass you an alert, please? A 10-year-old boy. He's had a 2-day history of being generally unwell, nausea, vomiting, not his normal self, very pale, and got a clear blotched rash along his body. They're going to be 7 minutes to yourselves. Obviously, we've got a very high suspicion that he's got meningitis.
For all ambulance crew, dealing with a critically ill child is the most stressful situation they have to face. Thanks to Tom's training and experience, Harry has the best chance of recovery.
What that child needs is a good hospital quickly. The fact that he's got a very typical septicemic rash over his body with the history of him being unwell and deteriorating throughout the day and looking very poorly. Those factors mean he needs antibiotics and he needs a hospital very quickly, and that's all we really did. It's a very rare circumstance you go to a child presenting with those symptoms. What I was very conscious of was not delaying on scene, so that's why I passed the details and let the crew, deliver that care ongoing. They're doing a great job. So, I just might pop and see how they go on.
The critical care team in the West Midlands operates 24/7, 365 days a year. Dr. Katie White and critical care paramedic Ian Locke are on standby, waiting for the next emergency as the all-night trauma response unit.
I think you get used to it.
You do get used to it. I think it gets harder as you get a bit older, I think.
Lockie would know better than me.
In the early hours of the morning, a call comes through to ambulance control. A car has been involved in a high-speed collision. a man is trapped inside with life-threatening injuries. Critical care backup is required.
We've been called to a road traffic collision. We've been asked to attend by a crew in attendance to a patient who has crushed their car into a concrete wall.
From spinal paralysis to life-threatening internal bleeding, the impact of high-speed collisions on the human body can be devastating.
They are just pulling down the Crescent Road towards the scene now.
Dr. Katie and Ian know they're going to have to get there fast if they're going to save a life.
5098 all received.
Eyewitnesses report the car was seen travelling at a high speed down the dual carriageway when it hit the roundabout.
We haven't got many reports of exactly what the injuries are yet, but if the crew are requesting us, then it's likely that they found something that they've got concerns about.
21 minutes after receiving the call, they are at the scene. The police have had to close the road, and firefighters are hard at work trying to free the injured passenger. Dr. Katie is a consultant anaesthetist. She spends half her time in a hospital and half on the road, responding to life-threatening emergencies.
This vehicle has been seen driving at really high speed down here and has basically just gone head first straight into this entire concrete structure.
To get her up to speed on what's happened, Katie is briefed by the paramedic operations manager who is managing the scene.
The driver is out walking around absolutely fine. The front seat passenger, when the crew rocked up, had quite a substantial laceration and head injury. Okay. Still trying to assess for other injuries, just trying to get the pain under control. Okay. It's so distracting for him at the minute. They're just going for a roof removal and to bring him out that way. Fantastic.
With the injured man still trapped inside the badly wrecked car, a member of the fire brigade is using the jaws of life, a hydraulic saw, to cut the roof away, while another protects him with a blanket as the blade passes inches from his head.
Head injury. Drowned now.
The man is conscious, but he was thrown around the car when it smashed into the concrete wall and may well have sustained serious internal injuries.
So I believe this gentleman has come from down this road, which is quite a fast dual carriageway, hit this concrete bollard. He's actually moved the concrete bollard, shunted it backwards, and interestingly, what we've just seen is that he's actually managed to bend the metal railing behind, and there's a significant drop the other side, so I think it's quite lucky that that concrete bollard's there.
Having examined the crash site for further clues as to how sick her patient might be, Katie wants to assess the driver who managed to walk free of the crash.
I've obviously seen the crash he's been involved in. He's all right. They're just going to get him out. Shall we get you somewhere where I can have a look at you?
Yeah, if not mine.
Yeah, I think I agree with that. Come on, let's go. Let's go down towards the ambulance, and I'll just find somewhere to see you.
Satisfied the driver is fine, Katie heads back to the crash site, where with the roof now off the car, Ian is finally able to examine the passenger. 22-year-old restaurant manager Sahil has been fitted with a cervical collar to protect him from aggravating any possible spinal injury. He's also complaining of severe pain in his left arm.
Do you want to take one side and I'll take the other? Get under this.
Sahil's legs are unharmed, so it will be less painful on his other injuries if he can stand on his own feet and be helped out of the wreckage.
So what we're going to get you to do is to stand up, all right? Turn very gently, we'll support you as you're doing it, and put your bottom kind of in the middle of the stretcher, okay? And then what we'll do is we'll get you to lie down, okay? So you keep your neck nice and still. Where's it hurting? On your arm? Okay, so not touch that arm. Okay, you support that arm and then come up towards me, okay? It's just too sore. Okay, all right. Do you think if somebody was behind you helping you just get up and out of the seat, that might help? Okay, all right. If it's too much, we'll get some more pain relief for you, okay? Okay, do you want me to support your arm? You can't.
If it's a no-go, don't worry, mate. No? Okay.
Shall we
go back to plan B then? We'll
Yeah.
go on the back.
Yeah.
Okay, Rick, longboarding down the back.
Sahil's arm is too painful for him to be helped to stand. so Katie and Ian will have to resort to plan B.
Have you got some morphine to draw up? Has he had any? Or has your crewmate drawn any? I think so. I think he's going to need it no matter what, isn't he?
With Ian in charge, the fire brigade start to slide a spinal board behind Sahil before carefully levering him out. Once he's flat, he can be lifted onto the stretcher.
We're just going to take him in the warm. Thank you. Lovely. There you go. No worries. How are you doing? All right? How old are you? 22. 22, okay. My name's Katie, I'm one of the doctors. All right. What's hurting at the moment? Sorry?
His arm.
So I think it's that arm.
Yeah.
So the options are, do you want to hold on to that?
Yeah.
I'm just going to cut your clothes, lovely. So we'll get some pain relief in.
Yeah.
Shall we splint it?
Free from the wreckage, Katie urgently needs to examine Sahil. Being thrown around the car, he could have broken a rib and punctured a lung or shattered a bone in his pelvis.
Take a couple of nice deep breaths.
From us, it was nice and
And that feels all right. Okay, lovely. Injuries top to toe. He's got a head injury, no obvious chest, abdo or pelvis injuries. He's got an obviously fractured left humerus with no neurovascular compromise.
Sahil is lucky. Despite the seriousness of the crash, he's escaped with a broken arm and a cut to the head.
He's had some IV morphine, an IV paracetamol and a splint to his left arm. Crew ETA to Sandwell will be 10:10 minutes. Received?
Roger, Katie, yeah, that's all copied. Thanks so much. I'll get that past you now.
Thank you.
Katie and Ian leave Sahil with the paramedic crew, who'll transport him to hospital while they prepare for the next Trauma Code Red.
Moves that concrete barrier, you'd think. Lucky. That patient needs to go to a hospital department where he's going to get a CT scan to have a look to just make sure that there aren't any other injuries that we can't see. We didn't feel he needed to go to the major trauma centre or that he needed us to go with him because I don't think as a critical care team we were going to add anything more to his care en route. He has had some pain relief. We've splintered his arm and now he just needs to go and have that thorough check over and then he's clearly going to need a surgery on that arm.
In the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got one male still trapped in the vehicle.
In the West Midlands, a highly specialist team is ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques in surgery, normally only seen in operating theatres, to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed alongside the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight,
Got an ETA at all to get him out?
It's going to be a minimum of 5.
emergency teams battle to free an injured driver.
I believe his legs are trapped by the pedals and twisted round.
DIY disaster after a pensioner falls off his roof.
You can't fall any further, Henry.
Medics fight to save the life of a cyclist.
Basically, he's got a thoracic brain injury. He is still breathing a bit. That is still him.
And multiple calls reporting a shooting.
There's a gunshot. You need to bring an ambulance now. Oh my God.
Yeah, but just from a... Just if we get another job on the way back, these hoods both got batteries, both clean to go. Back to base.
At base, Dr. Polly Haywood and critical care paramedic Sarah Foley are checking in for the night shift.
Right, we've got Rocurone in there, we've got fentanyl there, and we've got ketamine there. So they're drawn up, they're not used.
Dr. Polly spends half her time in hospital as an emergency department consultant
I feel like Tyrone Curry, actually.
and half on the road, responding to life-threatening trauma.
On the fentanyl, you've got the fentanyl vial, and we've got 3. Perfect.
Sarah is a full-time critical care paramedic, working shifts day and night.
There you go. Is it coffee time?
Ambulance service, is the patient breathing?
Westminster Police, can you join us at RTC, please?
Yeah, that's absolutely fine. Is the patient male or female?
Adult male. He's still stuck in the car that he's crashed into a wall. So we're on to fire to get them to cut him out.
Right, okay.
I've got no idea on his injuries because we can't get into them.
Right, he's stuck in the car.
Yeah.
It's a major crash. Police, fire and ambulance are already at the scene. Now they've requested specialist trauma backup. Polly and Sarah are immediately dispatched.
Go ahead.
Patient is still trapped in the car with no change in his condition.
Thank you, Grant. We're going to be 3 minutes.
The driver has been trapped for over half an hour and the full extent of his injuries is still unknown.
Trauma desk, this is Mike Delta 98, on scene. Oh, there's quite a lot of debris here, careful.
Evidence of a major impact is strewn down the street.
Where is out some railings,
And
there.
we've got the car just there.
The car has spun out of control, demolished a wall before flipping sideways onto a driveway. Firefighters are still working to free the driver.
Got an ETA from the fire to get him out. It's been delayed every time. Just try one thing and it's not working.
Polly and Sarah are briefed by the ambulance crew so they can now lead the critical care.
I believe his legs are trapped by the pedals and twisted round. I can't assess his injuries at the bottom because it slipped through the wheels. No could have mangled round him.
In the smash, the engine is shunted back, trapping the driver from his abdomen. But it's too dangerous for Polly or Sarah to approach him.
All I know is that it's lower back pain. Yeah. So we might have to ked him because I can't do anything until them legs are free.
The Midland Air Ambulance charity covers a region of 6 counties, one of the largest operating areas in the UK.
Element 03 Alpha's ready to start recall.
As well as 3 helicopters, the charity also supports the daytime critical care cars in cities and built-up areas, where it's more difficult for an aircraft to operate.
Right, Delta 98.
No, mate, you're not too far from this. I think about 4 minutes. RTC motorcycle v car.
That's lovely, thanks Steve, we'll go and have a look.
Critical care paramedic Colin Apps has been working for the service for the last 12 years.
You get to patients a bit quicker on the car in terms of the ones in the urban areas. You can make a real difference getting there quick and intervening in certain ways. It always seems to be busy when it's hot for some reason. I guess people are just more inclined to get out and about and do things and maybe do stuff they wouldn't normally do.
Experience suggests his life-saving skills will be in demand today.
Ambulance service, is the patient breathing?
I don't know. It's just fell off the roof.
Okay, how old is the patient?
81.
Are you with him at the moment?
I'm with him. It's got smack on his face, on his tummy.
Can you check if he's conscious and awake for me?
Are you awake, love? No, he's not answering.
Okay, are you breathing in and out normally?
No, he's not.
I've got help coming to you as quick as they can, okay?
An ambulance has been dispatched, but with the possibilities of a fractured skull and internal bleeding, the advanced clinical expertise of critical care paramedic Colin is also urgently needed.
So we're going to an 81-year-old male who's fallen off a roof. I think it was reported that he was unconscious, so that's where we're heading at the minute. And it's very close, actually, so we might actually be on scene first. 6-2, go ahead.
Falling from height is the biggest cause of death for people tackling DIY. Every week, someone is killed falling off a ladder. Fortunately, the address is just minutes from base, and Colin is first on scene.
What's his name?
Henry.
Hello, Henry. All right, my name's Colin. Can you hear me all right?
Yep.
All right, do you remember falling off the roof?
I haven't fallen off the roof.
Where have you fallen, from the ladder? Do you know where you are? Just keep your head nice and still for a minute, and we'll see what's going on with you, all right? You've obviously fallen and hit your head quite hard.
Henry, a retired teacher, was checking for leaks on his roof when he fell onto the concrete drive. His wife Patsy was at home and called 999.
He put his foot on the first one and he slipped.
Okay.
A local ambulance crew has arrived to help.
So he is conscious, he's maintained his own airway, he's got a strong radial pulse. I think the plan will be is that we'll mobilise him on a scoop, get him up off the floor, and then we can give him an assessment in the back of the ambulance.
As well as a significant head wound, Colin's also concerned Henry has suffered internal injuries. And any medication he's taking could make bleeding significantly worse.
Is he on any blood pills? No, not blood pills. He's on blood pressure tablets.
All right.
I've got his medicine. I'll get everything for you.
What's your wife's name? Patsy. Patsy, he's okay. Okay, he's fully conscious. Just relax. Go and just calm yourself down because we're going to look after him and he'll be fine. There's no need to rush around and get yourself all worked up. He's going to go to hospital for a checkup and some assessment, but he'll be okay.
Colin must keep Patsy calm. He needs to concentrate on Henry's trauma.
I'm just wondering, once the roof was off, how are we still lifting that engine block of his legs?
It's 3:30 in the morning, and Dr. Polly and critical care paramedic Sarah are waiting to assess a driver trapped after a serious crash.
Can I just get, cannula in and stuff like that?
They won't let me do anything just yet. They've got a spreader holding the actual car apart at the moment.
Right.
So it's quite dangerous. The front end is really sort of
unstable.
Okay.
Miraculously, despite the high impact, the driver is alive and conscious.
Got an ETA at all to get him out? Sorry.
It's going to be a minimum of 5.
Rescuing the injured in these difficult environments relies on tight teamwork between all the emergency services.
In terms of stability and access to the patient clinically, can we work through this space at all to put a cannula in?
We work around you if you need to.
Yeah.
Obviously, we're going to cut this now. We're going to get a lot more space. We're going to roof off.
Yeah.
Polly needs to make the operational commander aware that the driver's condition may suddenly become life-threatening.
So essentially, from a clinical point of view, 40 minutes plus, having that engine block in your legs is a bit like having a tourniquet on.
Yeah.
As you release it, you're going to just dump loads of stuff, and that's the point at which he doesn't look so good.
Using hydraulic jaws of life cutters, the firefighters begin taking the car apart.
My lovely, I'm going to give you something for the pain, all right?
An hour after the crash, and with the roof now off, Polly and Sarah can safely treat their patient.
It's paracetamol to start with, but into a vein, so it's stronger than normal. And then we're going to give you some morphine. Have you had morphine before?
Right. In a position now where we can release legs.
Hey, they're going to move the dashboard off your legs now, okay?
We've got a long board ready.
Having given the man pain relief, the team prepare to get him out.
Just going to have a look. Is that all right, mate? No, you're right. Even if you can't move it much, can you wiggle your toes inside your shoes, okay?
There's no blood around, so I'm happy that we're not bleeding and we can go.
Yeah. Okay.
Going well. Nice and steady.
Right, just wait a minute. He's got his leg very, very spread. Think about his pelvis. Sarah, has he got any pelvic pain? His legs are a real kimbo.
Before moving him, Polly wants to be sure he doesn't have a broken pelvis. This could cause a catastrophic hemorrhage.
Sweetheart, is there any pain in your middle by your hips?
No.
No, thank you. Can you come out now?
You can come out now if you're happy enough. There's no broken legs.
We need him out.
Polly stays alongside the man in case his condition suddenly deteriorates when they move him.
All right, mate, you're doing okay. All right, buddy, I know it's horrid. You're doing all right. You need to open your eyes for me, pal. That's it, good man. I know it's a horrid situation. Sweetheart, have you got any pain across your hips? In your back, in your lower back? Okay, from the middle. We're just trying to get some space to get you out, pal, okay?
Stay sitting forward as much as you can.
There's a hard board in behind you, okay? Yeah, of course we're going to be careful, pal.
Got enough people?
We'll take him to here.
Yeah.
That's it, well done, you're out, buddy. Okay, and down, and down. All right, matey.
Brilliant. Thank you, guys. That was brilliantly done.
It's taken a team of 21 highly trained emergency workers 72 minutes to get the driver out of the car.
Can you raise this leg for us?
Good man.
Yeah, that's
Okay,
fine.
now what he hasn't got is his pelvis.
No, so his pelvis is fine, intact.
To be honest, Polly,
Confident the driver has no immediate life-threatening injuries, the team prepare to move him onto the ambulance.
Okay, on your call at the head end, okay?
Okay, go.
that's easier.
And down.
Perfect.
Right, Delta 98, thank you. Patient is now being loaded onto the back of the ambulance.
While Sarah updates the trauma desk,
We're just going to do a top-to-toe assessment so that we can work out which hospital this is going to go to, is it?
I know your chest hurts to breathe, okay?
Polly assesses the level of the man's injuries.
We're going to bandage your leg, we're going to get you to hospital. All right, mate?
It's clear there is internal trauma. He needs an urgent scan. Holly and Sarah travel with him to the Queen Elizabeth Hospital, Birmingham, where he's handed over to the waiting doctors for emergency care.
What were you doing, Henry? What had you got up the ladder for?
In Oldbury, critical care paramedic Colin Apps is treating 81-year-old Henry, who has a serious head injury after falling off his roof.
Am I on the roof?
You're on the floor of the mountain, on your drive.
You can't fall any further, Henry.
Henry suddenly seems confused, a worrying sign his brain is not working as it should.
Okay. Ready, lift.
His brain may be swelling and pushing against his skull, reducing the vital flow of oxygen-rich blood.
So she's put the ladder away, but he was up at this top of the guttering bit, and it sounds like he's just missed his footing on the ladder and fallen. The ladder stayed where it was, and he just fell down to the floor. So quite a fall for his age.
Can I follow with my car off so I know where you're going? Just assess your needs.
They won't let you in the hospital when we get there.
But how will I know where it is?
So what we'll do is we'll take your details,
right,
just next to the kit, and someone will call you from the hospital, okay?
Okay, I'll come back.
COVID restrictions mean that Henry's wife Patsy can't go to hospital with him.
We just got him in the back of the ambulance. We're going to do a set of observations. He's obviously elderly, and he's had a decent fall, and he's lost consciousness, so that's a concern. We need to go to hospital with an alert so they can get him assessed and scanned, if possible, quickly, if he needs it. It depends on his condition when he gets there. Just have a feel of his chest for me. Just have a feel all round this, because you check, I know you listen, just have a feel all round, just check for any fall. Does it hurt anywhere where we press on your chest?
As well as damage to his brain, Colin is concerned the impact of the fall may also have injured Henry's lungs.
Henry, do you have any pain in your tummy?
A blow to the chest can cause fluid to build up, which has life-threatening consequences.
And with your legs, can you move your legs for me? Turn that one. Can you feel me touching all the way down your legs? Yes.
Any pain in your chest at all?
You see?
No, that's all right. You just look a bit red in the face.
After masking up, Patsy is allowed onto the ambulance to say goodbye, while Colin updates the trauma desk.
He's impacted the ground with the right side of his head, where he's got a large swelling and laceration above his eye and around his right zygoma. He also might have a broken nose. He's got no neck or back pain. He's got no chest pain. His chest all seems fine on examination. He's not 100% sure exactly what's happened.
To let you know, we're going to stand.
Colin is happy Henry is stable enough to be left with the ambulance crew for the 10-minute journey to the nearest trauma centre.
They will assess his whole body. They'll make sure he's not got any injuries they haven't missed. They'll monitor his observations for a good while. They might even keep him in overnight. They might keep him in longer than that. He'll be in A&E initially, and then he'll probably be moved to a ward. So just try not to... As he is at the moment, he seems like he's recovering well. He should make a good recovery, how he seems at the moment, all right?
Thank you very much indeed for all your help.
All right, you take care.
Sorry about this.
No, you don't be sorry. We just hope he's all right, so all the best. His risk factor is his age, and that's why he's going to the trauma unit, where they can give him a rapid assessment to make sure that he's not going to deteriorate. You know, he's 81, he's fallen off a ladder. There's plenty of 20-year-olds that have fallen off ladders, so yeah, he's just got to be careful. But I should think he'll be able to get back to his DIY soon.
Hello, the ambulance service. Is the patient breathing?
Is he breathing? Is he breathing?
Yes, is he conscious and awake?
He's bleeding really badly.
Hello? Can you have an ambulance quickly? Sorry, I'm a nurse.
The patient's not fully conscious at the moment.
He's breathing, but not fully conscious.
Okay, just explain to me briefly what happened.
He was on a cycle and he's gone over at the junction and a car hit him.
Is the highest priority so over there as soon as we can?
We have a cyclist being struck by a car, one patient. The patient is fitted with a head injury, so if you could leave all resources running, please.
An ambulance has been dispatched, but there's a high chance the cyclist has a significant head injury.
Police are in attendance, shutting the road off. There's no danger to the crew. Don't require any other resources if whatsoever.
Critical care paramedics Aidan Brown and Ryan Ferris have been scrambled.
The initial reports have came through that he's unconscious and having a seizure. Likelihood that he could be a very unwell gentleman with quite a significant head injury.
Reports of the cyclist's condition is so serious, a trauma doctor has also been dispatched.
We've got a run time of 1 minute.
When they arrive, police and paramedics are already on scene.
Hello, good morning, good morning. Hi, I'm Ryan, one of the CCPs.
Hi, bud. We're a cyclist. It's very irritable now. He's got a nasty wound.
Was there any sort of active seizure activity on your arrival?
Yes, he's fitted.
He's fitted, has he?
I need you to sit still, darling.
All right, sir.
Try and relax for us. We've got you.
The 22-year-old cyclist was on his way to work when he crossed a busy junction and was hit by an oncoming car. The force of the impact threw him into the windscreen and he landed on the road.
Has he got a blow-in pupil?
No.
No, that's fine.
He wasn't wearing a helmet.
Eyes 1, voice 2, motor 5, so we'll give him a GCS of 8 with a high motor score.
Ryan's initial examination indicates an extremely reduced level of consciousness and a life-threatening brain injury.
Significant right-sided head injury.
Yeah.
But he has got a high motor score. No overpowering injuries, moving all limbs independently. Just very agitated.
Although unconscious, he's fitting and at risk of making the injury worse.
If you're happy, I think what we'll do, we'll sedate him a bit, get him relaxed.
Yeah.
We'll get him scooped onto the stretcher and we'll potentially just prepare in case he needs an anaesthetic and we'll get him off to sleep.
Aidan quickly prepares ketamine, a drug carried especially by the critical care team to calm him down.
I go 30 milligram potentially initially, just to try and get him relaxed.
Okay. Just hold that still for us, mate. Sorry. Let's just get a monitor. We've got the monitor there. Ryan, are you happy with the primary survey?
Sorry, primary survey-wise, yes.
Yeah.
Chest moving equally.
Yeah.
You've seen him move all his limbs.
Yeah.
He's both straight leg raised independently.
Okay, cool.
But just sort of talk to him all right, because with the ketamine he's going to have a bit of a strange sort of experience, okay?
The man is so seriously injured, he needs to be put into a coma. But there must also be a trauma doctor present to administer the anaesthetic.
I'll tell you what, let's get a bandage over that cannula as well. That's fine. All right, guys. This gentleman's going to go off to sleep. Okay, so just to make you aware, we're going to just prep, get him on there, and then we're going to give him an anaesthetic and set him off to sleep. All right.
So he's got a traumatic brain injury. Is significantly agitated with a low GCS. So we're just waiting for the HeliMed's medic crew with a doctor on board, and the plan is to take over his breathing, and then he'll be going to a major trauma centre. You stay with the patient, man. Make sure we've got a full assessment.
Yeah.
I'll set up for an RSI here. Okay?
Yeah, that's fine.
While they wait for the doctor, Ryan and Aidan prep for the complex procedure, one that's normally only carried out in hospital.
So what we'll do, the obs are on. We'll get that on a 3-minute cycle, if you don't mind, please.
The cyclist is still in a very unstable and agitated state.
Have you got the ketamine still?
Yeah.
His blood pressure's fine. He's starting to fight us a bit more. Are you happy if I go for another 20?
Yeah.
Guys, just going to give him a little bit more ketamine, all right, just to relax him.
Thank you. Have you got a rough ETA, please?
Aidan checks the ETA of the doctor.
Just for your information, the patient is packaged on a scoop. We are fully prepped for an RSI, so we're ready on your arrival or received.
Any delay could be fatal.
Thank you. 7064-203 over. The patient appears to have a traumatic brain injury, significantly reduced GCS and agitation.
Okay, everybody happy?
Right, okay, guys, so I'll take over from here. So we need 2 people going to do an RSI, so he's going to anaesthetise him. Okay, the doctor's just a few minutes away.
A trauma doctor is en route, while the team at the scene prepare to put the critically ill man into a coma. This should reduce swelling and prevent any further brain damage.
So just pop that out the way if that's okay, mate. Okay, so hopefully we'll get that reading in a second. We should have everything pretty much good to go. That's okay, I've got it here, yeah. Yeah, so just wait until we get some end tidal. That suction's all good to go. So observations are okay. We're in a good position in that sense. So as soon as we get some more ketamine, it'll stay a bit flatter and we can prep for the RSI.
Managing the patient's airway during the procedure carries a high risk of COVID transmission, so the critical care team must wear level 3 protective suits.
Okay, I'm going to take over this, okay?
Okay.
Thank you.
Okay.
Okay, are you happy?
Happy, thank you.
I'm going to go and get level 3, Ryan.
Yep.
So everything else should be good to go.
With everything now prepped, a second critical care car arrives with a trauma doctor on board. Aidan quickly briefs him.
It's been quite agitated, so it's had some ketamine. Everything's ready, including the drugs.
Yeah.
So pretty much, as long as you make a quick assessment, whatever.
Yeah, he's on this one now.
All right.
Dr. Jake Turner can now oversee the life-saving intervention.
Okay, guys, I'm going to go through a checklist, all right?
Okay.
So oxygen supply, oxygen, end tidal, BVM, suction, on and working, ECG, and ketamine. He has had 100 milligrams already, so now there's 100 left in there.
The doctor now administers the drugs that will temporarily shut down brain function.
Yeah, feels fine to ventilate. He is still breathing a bit. That is still him.
We're happy at the moment. Happy with the air.
Happy, he's still saturating fine.
Okay, I think we have apnea now. On the ventilator.
At the point where the man is paralysed and no longer able to breathe for himself, Ryan must insert a breathing tube down into his lungs.
Okay, right.
Thank you.
Suction is here.
Cheers. Got it. Okay, got a grade 2 view, please. Of the bougie.
You have the bougie.
Thank you.
He has just 5 minutes to start ventilating, otherwise he could die.
Hang on.
And the
I have the bougie.
Bougie through the cords, that's 23 centimetres at the teeth.
Okay, Ryan, you want to hold left hand, right hand?
Left hand, please.
Happy with this?
Happy, thank you. Thank you for that,
I'll
Aidan.
sort the vents inside, shall I?
The team have successfully anaesthetised their patient and taken over his breathing.
Okay, so end tidal 6, so I'm just going to back a little bit more, bring it down.
Okay, guys, vent is set up inside, ready to go.
He's now ready to be taken to the nearest major trauma centre.
So, happy, he's on about 480 volume. You happy to bring his rate up slightly?
Yeah.
Just with that end tidal.
6-2, thank you. Atmos when you're ready.
Aidan puts in a call to alert them of his arrival.
Thank you. Approximately 20-year-old male, traumatic brain injury, treatment given. He's had TXA. He's had an RSI with rocuronium and ketamine. ETA to the QE is 12 minutes from now.
Ryan and Dr. Jake travel with the man to provide continuous critical care throughout the journey.
GCS initially, eyes 1, voice 2, motor 5, GCS 8, so he had a high motor score.
The paralysing effect of the anaesthetic lasts for less than 30 minutes, so they have to constantly monitor to avoid any conflict between the patient's natural breathing and the ventilator.
If we can take that further down on his legs, almost. Happy?
Arriving at the Queen Elizabeth Hospital, Birmingham,
Thank you. Can I pass you that?
the critically ill man is taken directly to the emergency doctors.
Initially, with the impact in the head injury, the patient can present a lot worse than the injury actually is because of the initial impact to the brain, the swelling, the bruising. So we won't really know anything until he gets a CT scan. And even then, it may be a few days he remains in an induced coma whilst the brain recovers. And he may have a very positive outcome. Unfortunately, he appeared to be a very unwell gentleman at the scene, so I can only hope that he makes a positive outcome.
Ambulance service. Is the patient breathing? Can I have an ambulance? Is the patient breathing? I don't know if the patient's breathing. There's been a gunshot. There's a gunshot. You need to bring an ambulance now. Oh my God. What's he just? No, I don't know his name. It's near like a field. There's another call coming through. Yeah, I've got it. Black patch car. Yeah. Did she say what had happened? Gunshot.
Every year in England, around 30 people die and over 160 are injured in shootings. With the possibility of a major incident, the police firearms unit has been dispatched, and so too have the critical care team of Dr. Ravi Chauhan and critical care paramedic Richard Apps.
The information is a bit sketchy. It sounds like the call might have come from the firearms unit saying that shots have been fired, but that's the only information they've got. Then there's lots of other calls that are apparently coming in, but we haven't really got any information on patients at the moment.
So that's firearms that have just gone
flying past us.
Emergency teams are racing to the incident, but in dangerous cases like shootings, ambulance crews and the critical care team meet at a rendezvous point until police make the scene safe.
I'm just going to ask him what's occurring.
Operations manager Jason Lowe is also on scene.
Right, so...
Have we got patient info at all?
Someone I got when I first got the job has been shot in the head. One crew member from that vehicle can drive this one in, so if they are any arrests, we can go and take it.
Yeah.
All right.
Yeah.
I'll just have a chat with Greg on the 17th.
Yeah.
The medical team need to change into full PPE, as resuscitation of the gunshot victim sounds likely.
I will put a Tyvek suit on just in case, but not my respirator, obviously. Because it's a reported shot to the head. So if we do go forward, good potential that it'll be an arrest.
While police search for the gunman and casualties, all Richard and Ravi can do is wait. The critical care team in the West Midlands operate 24/7.
We're on the way to someone who's been stabbed in the neck.
At night, when the air ambulance doesn't fly, a doctor joins the fast response cars.
Look at me. I'm going to get you onto the ambulance, OK?
Tonight, Dr. Matt Rowley is on shift with critical care paramedic Jack Lewis.
Good evening, Grant. We're just going to get some caffeine, mate. Obviously, all checked available and waiting for your call.
Hello, mate. There is literally a job that's come in for medic request. If you are good to go.
Yeah, send it through.
Hello, you're speaking to the ambulance service at the main end. Somebody's had a car crash. It's completely fucked. Okay, how many cars are involved? He's lost control and it's a tree. Okay. His cars are right up. Can you see whether they are breathing? Everybody's breathing, but he's empty. Is he responding to anybody? No.
There's reports of a car into a tree, not very far away from us. Potentially multiple patients, one unconscious, we believe. We've got multiple resources en route.
On average, 5 people die every day on Britain's roads, with countless more seriously injured. Jack and Matt's enhanced life-saving skills are urgently needed.
Quick update from scene. Conscious male patient at the present, bleeding from the abdomen. Not surpassed by extreme damage to the car. Update you further shortly.
So, multiple patients. Sounds like we've got at least 2, and a male. Sounds like they're still in the vehicle with a bleeding abdomen. I think this gentleman's got potential to be unwell.
On their arrival, police and ambulance are already on scene. One patient, the driver, has just been released from the car.
If you're happy, just continue to the back of the truck and we'll meet you on there. I'll take a look at the car. All right.
He was conscious when the passerby got to him, and they pulled him out of the car, placed him in the recovery position.
The operational commander briefs Matt on the incident.
He's jumped a fair way up that tree, hasn't he?
He really has. So it is a fair way up, and there is quite a bit of passenger space intrusion.
Yeah.
They did pull him from the driver's seat, so his side was quite free.
Right, cool. How are we doing?
With the driver now on the ambulance, Matt begins assessing the extent of his injuries.
Can you give my hand a squeeze for me? Good. Can you stick your tongue out for me? Stick your tongue out. Roughly, yeah. Squeeze this hand.
20-year-old Khalil, a restaurant cashier, was driving home from work when he lost control and crashed into the tree.
So unconscious with passerby then, he pulled him out, but then like this with you guys when you got here?
Yeah. When he first got there, eyes were closed.
Yeah.
As soon as he moved at all, open eyes, with no response at all.
Khalil is agitated, but not responding to any commands.
Sit still for me, all right?
Keep your head down. Good man. All right.
Whatever you want.
Right, keep your head down. Good man. All right.
Jack inspects the car to get a better insight into what injuries Khalil may have sustained.
So significant passenger space intrusion. Driver space looks all right.
The windscreen has a clear imprint where Khalil's head smashed into it.
So he's clearly been unrestrained.
Jack updates the trauma desk.
Airbags have been deployed, and it's clear that the seatbelt was not being worn. It's still fastened, so he's been sat on it by the looks of things.
All the indications are Khalil has sustained a life-threatening head trauma.
I haven't got you a full GCS breakdown, but it's safe to say he's not a GCS 15. It will probably either be the QE. We're just getting him on the back of the vehicle and sorted out. We'll come back to you with some obs and a plan shortly. Not behaving normally. We're going to sedate him slightly, but it might be that that escalates to a full anaesthetic. But I'll come back to you with full details in a little bit. Received. Just relax, mate. Just lie back.
Yeah.
Lie back.
For me, all right? Keep your head down for me. Good man.
9660. You want to just snapshot that for us?
We've got BM5.
BM5, cool.
You can see from the vehicle that all the impacts have been taken on the passenger side, which is probably the only reason he's still alive. Although he's not been wearing his seatbelt, so he's clearly been thrown around in the vehicle. We can't see anything obvious in terms of fractures or huge wounds, but his behaviour is certainly not normal, potentially consistent with a head injury, like a closed head injury. So our first step is we're going to just give him a little bit of sedation so that we can assess him properly and calm him slightly. And then if needs be, it might be that becomes a full anaesthetic, but he's certainly gone through a significant mechanism of injury there.
So we're going to give him a bit of ketamine, just see if we can get him chilled out a bit.
Yeah. Okay.
If we can't get adequate control of some ketamine, then we'll put him off to sleep.
Sit still for me. Good man.
You smell any alcohol at the top end?
Maybe.
No.
While giving the ketamine sedative, Matt and Jack discuss his coma scale assessment.
So GCS-wise, we are probably an E3, V1, motor, and then 5 probably, to localise.
Khalil's score is on the border between moderate and severe brain injury.
Is that a fair impact?
Oh, it's massive.
Enough to shake his head around. Can you give my hand a squeeze for me? Just squeeze my hand. Good. So yeah, he obeys commands. So if you're happy, I think we just go. Airway-wise, he's all right, isn't he? He's oxygenating, he's ventilating well. As you said, whether he's a bit shook up because he's had his brain rolled around his head. I think if you're in agreement, I don't think we should RSI him at the moment and just...
His airway's very patent, it's not maintained.
Just a little bit of ketamine if he gets unmanageable again, and 20 seems to have worked the trick.
Yep, sounds good to me.
After assessing him, Matt and Jack don't think a full anaesthetic is needed.
Up to the QE.
The ketamine has relaxed Khalil, enough to ensure he's safe to travel to hospital.
60.
Yeah, go ahead.
Jack updates the trauma desk, who will alert the Queen Elizabeth Hospital, Birmingham.
We can't find any obvious kind of musculoskeletal injuries. There's no abdominal guarding, chest seems clear, and nothing to the head. It's had a small amount of ketamine sedation, but doesn't require anything further from us. So we're going to be escorting to the QE with an approximate ETA of probably about 20 minutes. So.
Yep, that is all received. I'll give them a shout for you.
Khalil is still in a life-threatening condition. so both Jack and Matt stay on the ambulance to closely monitor him, ready to intervene on the journey if necessary.
You give my hand a squeeze for me? Good. All right, well done.
He will open his eyes if you ask him.
Yeah. So we're going to take him into resus at Queen Elizabeth Hospital. He'll get assessed by their trauma team. They'll reassess his airway, breathing, circulation, and then he'll probably need to go for a CT scan of his head and any other bits of his body that the team feel appropriate when they have a look at him.
At the Queen Elizabeth, the critical care team hand Khalil over to the trauma doctors for the next stage of his emergency care.
It's a massive impact, massive mechanism. Even we don't see that type of mechanism that regularly. And although we get a lot of RTCs, generally if people are wearing their seatbelts, they generally do okay. But as soon as people stop wearing their seatbelts, those are the ones that tend to come across our door a little bit because they generally have more significant trauma, more significant injuries that require our support. Anyone involved in that type of incident is lucky to be alive. You know, if the car had hit the tree on the other side, then, you know, he probably would, you know, that would have probably been a fatality.
Ravi and Richard are in Smethwick, responding to multiple calls reporting a shooting. Police have been searching the area for the last 20 minutes.
There is evidence of a party, but there's no sign of any shooting, no sign of any patients, no sign of any disturbance.
It could be a malicious call, but the emergency team need to be sure no one's in need of their help.
Try and get us cleared.
They've gone into the suite room, there's nothing there. So I took on the phone and say that we need to go into the suite room.
It does sound like it's going to turn out to be a hoax. Or, if not a hoax, a misunderstanding or misheard gunshot. So we'll, at the moment, I think we're going to stand by with the first crew, but we may get stood down ourselves shortly.
Another search of the area uncovers nothing. It's a frustrating but not uncommon false alarm.
So the firearms unit, they've probably got a few of them roaming around, and then obviously, yeah, we've got 2 crews, 2 officers and ourselves here, so yeah, it's quite a lot of resource for these kind of things. Fortunately, lots of them don't turn out to be anything. The majority don't, so, which is a good thing.
In the 25 minutes Ravi and Richard have been on scene, West Midlands Ambulance Service have received 70 genuine emergency calls.